Hi, my name is Eric, and I am a nurse in the Newton-Wellesley Hospital Intensive Care Unit. In this video, we will be talking about various equipment you may encounter as well as the surroundings. We hope that by watching this video, you will feel more comfortable and aware of the surroundings of the ICU. In this video, we will talk about the infection control, precautions, monitoring equipment, breathing devices, and invasive lines. It is important to prevent the spread of germs and illnesses. Staff may use a special way of caring for you based on your conditions called isolation precautions. In the hospital, these precautions help to prevent the spread of infections. Patients who require certain precautions will have a sign placed on the outside of their door. Please look at these signs before entering the room to ensure you protect yourself and the patient. The best way to prevent infection is by washing your hands. These are alcohol-based hand rub stations outside and inside each patient's room. Please use the alcohol-based hand rub before and after visiting a loved one. We check vital signs frequently and adjust treatments as needed. You will see us often checking in to ensure you're comfortable in addressing any concerns. Each room is private and equipped with advanced technology and specialized monitors that track your heart rate, blood pressure, oxygen levels, and other vital signs. With our monitoring capabilities, your nurse can view your monitor from outside the room. Continuous monitoring of your vital signs help us ensure patient safety through awareness of any changes in your health status and guides your treatment plan. Some people need more oxygen than what is in the air around us to breathe easier. In the ICU, we can deliver oxygen through multiple methods depending on the support you need. One of the most common types of oxygen delivery method is by nasal cannula. This is a plastic tube with two prongs placed in your nostrils. This delivers a gentle and low amount of oxygen and is used for mild breathing problems. Sometimes, patients with more serious breathing difficulties need more oxygen than a regular nasal cannula can provide. That's when we may use a method called high flow, which can give you a larger amount and higher concentration of oxygen. Using a high flow lets us adjust settings to give you the right amount of oxygen based on your condition. BiPAP is another form of respiratory support. This device uses a face mask connected to the machine that helps push air and oxygen into your lungs. This is typically used for patients who need oxygen as well as breathing support. When a patient has difficulty breathing on their own, we may use a ventilator. A ventilator is a machine connected to a breathing tube that delivers oxygen and moves air in and out of the lungs. Ventilators help the lungs heal and ensure the body gets enough oxygen, playing a critical role in recovery. The time a patient needs a ventilator may vary. Some may need it for a short period of time, while others may need it for longer depending on their condition. We monitor patients closely, regularly, checking vital signs and laboratory data to gain insights on the patient's overall condition. While on the ventilator, it is very important to us to make sure the patient is comfortable in getting the support they need. It is common to administer medications to make sure they are not experiencing pain. We understand that seeing a loved one on a ventilator can be very overwhelming. Our team is here to support you and your family, answering any questions you may have. In the ICU, it is common that patients will need multiple forms of intravenous access to provide continuous medications. A peripheral IV is a small plastic tube placed in the vein in your arms or hands. Medications may be given through your IV for controlling blood pressure, managing pain, and treating infections. For more critically ill patients, we use central lines, which are larger IVs placed in the large blood vessels, typically in the arms or the neck. These lines allow for more efficient delivery of medications and fluids and can be used to draw blood for lab testing. An arterial line is a small catheter placed in an artery, usually in your wrist. It gives a constant and more accurate measurement of your blood pressure. This allows nurses to take blood samples and easily and especially helpful for patients who need medications to control their blood pressure or have heart or lung problems. In the ICU, not every patient will require these advanced lines, but for those who do, they are essential tools for providing specialized care. These lines help ensure that critically ill patients receive the treatments and monitoring they need to support their recovery. Thank you for watching our video. We hope this information provides you with a brief introduction to the environment and the equipment you may encounter. If you have any additional questions, please do not hesitate to ask your nurse or any members of your ICU care team.